Good morning, and thank you again for joining us today. Our first speaker for the post-pandemic animal welfare session this morning is Dr. Donna Matthews-Jarrell. Dr. Jarrell, you're welcome to start sharing your slides. With over 30 years of experience, Dr. Jarrell has managed laboratory animal welfare programs in government, industry, and academia. She earned her undergraduate and veterinary degrees from North Carolina State University. Since earning her degrees, she has worked for the NIH as a Public Health Service Commission Corps officer, at a CRO, and at a biopharmaceutical company, and for Mass General Hospital, where she currently serves as the attending veterinarian. She also currently serves as the president of the American College of Laboratory Animal Medicine. Dr. Jarrell's talk today is titled Animals First, Redefining Facility Operations and the Utilization of Performance Standards in Animal Husbandry and Care. Welcome, Dr. Jarrell. The floor is now yours.
Good morning, everyone. I'll try again. Thank you so much for the invitation to be a part of the symposium today. I am going to speak not so much on what we do, but how we do the work that we do in supporting animal research. And because I have a very extensive presentation, I'm going to stay high level and go pretty fast. But I hope to give you references or places to find more information about some of the topics that I cover. So just to get started and stay on time, I'll get going. So the first thing I want to acknowledge is that I am looking at a few key points to cover with you. And the first is to understand how your culture and the organizational strategy that you use in getting things done can enhance the organization's agility. And as we all know, over the last 14, 15 months now, agility has been the key word when it comes to how you operate during the pandemic. I also want to take a few moments to reflect on what we learned along the way at Mass General in regards to how we responded to the pandemic, what worked for us, and what we want to think about maintaining going forward. And we consider ourselves a learning organization. That's a favorite term, I think, in looking at organizational strategy and culture, where everyone is engaged and everyone is contributing to the knowledge base of the organization. And last, I want to talk a little bit about how the awareness of disruptors, and I kind of spoke to that in my description, that there's the disruptors that happen when something interrupts a process, but there's also disruptors that actually elevate and transform you into a new organization that is sustainable in the future. So I just want to look a little bit at how those disruptors are going to play into what we do going forward. So I am at Mass General Hospital. We are a large organization, as you can imagine, in Boston. I run the Center for Comparative Medicine, and I say I run it, but I support it really. We have a mission statement that focuses on the research that we support and assuring that we provide a reliable, affordable, and responsive service to that effort. We also are focused on the animals, making sure that we meet their welfare concerns, especially through the minimization of pain and distress. And I want to speak specifically about the people that we rely on to fulfill those first two components of our mission statement. And we have to think about what their work experience is about. Is it fulfilling, respectful, and safe? And so I just will use this as background for how we operate. And I want to take you on a little bit of a journey to show you what it looks like real time. So one of the things that I want to highlight is that the Center for Comparative Medicine at Mass General is an evidence-based organization. So even during the pandemic, we did check in with our staff on a couple of things to make sure that we were succeeding in supporting them during the pandemic. So at the end of 2020, we actually did, through some virtual focus groups and surveys, an assessment of how well are we doing in our department as staff and also in fulfilling our mission. And I'll speak a little bit later to the fact of the composition of our staff at the time of the pandemic. But one of the things that we found out is even with new staff and even with the disconnections that we all felt, that the staff still appreciated having very, very high awareness of why they came to work and what their goals were in performing their task. And that's the foundation for change too, as well. So we all felt when we went into this pandemic that, yeah, we pretty much thought through it a little bit. We had some help in elevating some near misses in the past to think about what it would look like. But in reality, we didn't have an idea until we actually ran the pilot. So I want to acknowledge that our culture helped us in performing and reacting to this pandemic. And I won't go into the backgrounds around lean management. The other words that you hear today is an agile organization. You even in the new Toyota Way 2nd edition by Jeffrey Liker, he speaks to organic organizations. And the idea is that these organizations will have the flexibility because of its culture to react to whatever they face. And it's based on 4 key processes, or P's they call it: philosophy, how you treat your people and partners, how you look at your processes, and most importantly, how you do evidence-based problem solving. And I just wanted to highlight that this concept is even published in our 3rd edition of Lab Animal Medicine. If you want to know more about this concept, there is an organization that is affiliated with ALAS called the Vivarium Operations Excellence Network, organizations internationally that are focused on utilizing and implementing these kind of philosophies in their workplaces, all lab animal based. So when I said we kind of prepared even before the pandemic, there were key things that I want to highlight here. One is that we focused as an organization in bringing this new culture and making it live and making it sustainable. And that required continuous improving and continuous checking in. So everything that we've done, we do validate, and we do try to even evaluate short-term and long-term for our sustainability. But we organized our department into teams. We taught our teams about the importance of standardizing work whenever possible so that you could then determine where changes would be effective, that you then walk those areas and validated that what you thought was happening was actually happening. And through those experiences in the facilities, you start to teach the staff how to reevaluate what they're doing, looking for ways to make their jobs better, looking for ways to save time and energy so that they can focus on the animals and not focus on things that actually, in the end, are not really value added to our mission statement. We have been at this for 15 years. We have realized that there has to be constant check-ins on key factors of our organizational strategy. And so even in 16 and 17, we've been reboosting and re-educating everyone on what it means to work in a lean organization. And then COVID hit. So I'll just real briefly give you an example of what organizational strategy gets you and how it actually worked for us in preparation for March of 2020. One of the things that we do every year is we do a strategic planning session. And in that strategic planning session with our leadership team, we talk about the things that we are facing right now that we need to address. And one of them was that at the time of fiscal year 16, we had an attrition rate of our frontline staff of greater than 30%. We're in the Boston area with a lot of competition, and I can go into why that was the case. But the reality is that everything we were teaching our staff was leaving, especially around our culture. So we agreed as part of our strategic planning to find a new way to educate our staff on our lean knowledge and put it at the workplace, put it with the teams. And the reality, as you can see here, is that as we got into COVID in fiscal year 20, we actually had seen that attrition drop to the lowest. So we actually had a full staff when we went into the pandemic, but we have been working at that for 3 years. So the other components of our lean culture that I wanted to highlight is that we have to have a culture where people are comfortable to bring problems to the surface so that we can solve them. And the idea is that we have to avoid blaming people when they see things going wrong or when they can't successfully complete their work. And we have to tell them that it is more important that you bring it to the surface so that we can help you resolve it as a team of stakeholders. When you look at employees and having them engaged, you have some just basic needs that they need to be fulfilled. And I'm just checking on my time, sorry. Do they have what they need? Do they understand what the expectations are? Are they able to do their best work every day? Does someone ask them about their careers? Are they encouraged to advance? Do their opinions count at work? These are the things that keep people in the workplace. And if you think of that attrition and you think of all of the data that we have from Pew and others about the decline in support of animal research, we really have to make sure that the folks who we're relying on, that the animals are relying on, are taken care of. One of the things that we did in our organization was to create teams. I can go into this for another hour. I won't have the time today, but the reality is the benefit of teams allows people to work together to solve those problems real time without having to engage layers that really are not familiar, more familiar with the problem. And when they can't, they reach out, and we all support and lift up our teams. Here are just some other examples of our workplace at Mass General. We rely on a visual workplace. There's a lot of instructions in the workplace with visual pictures to help overcome some of the challenges, say, with English as a primary language, et cetera. We ask our staff to map out their processes so they can see where problems exist or where confusion happens. And they do that everywhere as a part of their problem-solving process. And then we ask, when you have a problem you can't solve, that we will come to the workplace, we will help you look at that problem, and we will help you solve that problem. We call it pulling the cord. So when we first started our response to the pandemic, the reality was that this was going to be a real test of the agility of the organization. And we thought it would be a 3 or 4 month test, as many of you all did. It's actually turned into a 15-month test, and it will be going beyond. But in reality, everything that we did involved groups coming together who had a stake in the decisions to formulate the decisions and the plans and the guidances going forward. We had 2 primary goals, and it was important that we come together around these goals at the beginning. One is that the animals are taken care of, and the second is that the workplace is safe and supportive for the employees. Every decision we made had to accomplish one or both of those goals. So we initially said, we're going to go in and find waste. Waste is a word that we use in our department as a part of lean management. Downtime is a great acronym, but as you can see, it's not waste in the general definition. It's waste in things that you wish you didn't have to do in supporting the animals. So moving things around, having to go look for things, that's all waste. We asked the staff, focus first on the animals, and we told leadership, now we're there to focus on the staff. Just some early data that I'd like to share to just show that in the hospital at Mass General, we got elevated through our ability to advocate for ourselves, that while the hospital is seeing reductions in the number of patients in-house, or a number of people getting cared for on a daily basis, that wasn't happening in our area. We were there taking care of all the animals 7 days a week throughout this whole pandemic. And by bringing that partnership to the surface, we got prioritized for PPE. We were able to work with our vendors to create good programs for preserving our mouse colonies that were critical. And we also understood what research we would do and what research we would not support. And that was really critical for us to try to resource the work we had ahead. We, along with trying to figure out how to keep the least amount of staff on site, which was a guidance that everybody was following, we had to look at what would happen if our staff started to fall ill and create that staffing continuity plan. And that included how you would train them, who would train them, and how you would assure that they were able to perform this work independently. And that we looked both at research staff and non-facility staff to fill that role. We also looked at spot changing like many organizations, and I have some information about that at the end. And most importantly, this is an example of my calendar. And the goal here is a weekly calendar to acknowledge the olive greens, which are communications within the organization, either up or down, regarding anything related to the pandemic and the current decisions that were being made. So we shifted to, we met every other day, 3 times a week initially. We shifted to daily, and then we shifted to twice daily as needed to meet. And how we conducted those huddles, as we called them, was already defined in our structure. Outside of the Center for Comparative Medicine, but within the Research Institute, I think it was very interesting that all of a sudden, all leadership from the Research Institute consolidated and met more frequently. And it was really interesting how more information got shared quicker, just simply by including more people at the table. And this is our institutional official in summer last year, just about this time, visiting one of our facilities to let the animal care staff know that they were valued, to have the IO and myself there. We used a lot of electronic communication, like most people, continuous communication, but we even formalized those communications so that people knew where to go get the information, because asynchrony of schedules was a big part of the challenges, is that you couldn't get everybody in the same place at the same time. Just some examples that we did not use before that became really important. A lot of videos were created and posted to make sure that people understood the information that was being shared. The communication by email, I think, became the least effective over the 15 months. A lot of signage. We're a very visual workplace, so we constantly updated our signage, and by updating it, staff knew to recheck it. Research customers knew to recheck it. And we formed feedback portals to make it easy for folks to find what they needed when they needed it, both for our internal staff as well as our external staff, instead of relying on phones, emails, notes left somewhere. We actually tried to consolidate into an electronic system, and that was very helpful. What I think is really important is that you don't tell people only what it is that you expect of them, but you tell them why it is the guidance that you're giving, so that they can make good decisions when they come up into challenges in the workplace. So in our communication, we tried to give as much feedback as to where the decisions were coming from, such as what the expectations were for coming into the facility. It was based on NIOSH's hierarchy of controls. In the end, we actually met frequently with our research community, and we found that there were so many things that they never asked, but when you meet with them frequently, they get more familiar with the relationship and they're more open and trusting to bring their problems to the surface. And by doing that, we were able to give them better recommendations on how to respond and how to work during this pandemic. Important things about, you're no longer there with 5 other people in the lab who can help you if you have a problem. So make sure whoever's in the lab is competent in doing the work that they've been assigned to do. that these handoffs are going to be really critical when people are sharing research projects, which they didn't do before, but are finding it works better, I think, today, is that when you stop your part of the study and you hand that off, that's very, very, very clear, especially when it comes to the welfare of the animals, and that you have written plans for everything from how the work will be done, posting your procedure forms in the labs, to posting your schedules. So if someone is sick or not able to come, and sickness is not just COVID. We have people who are dealing with all sorts of illness, distresses, post pandemic, and even before pandemic getting elevated. And so you have to have that backup plan for what you're going to do when someone's not able to come to work. As I said, we're evidence-based. We really want to focus on these key performance indicators that would tell us when things are shifting in the negative, or when we should be able to do maybe some things that we had to put on hold. But we understood that quantitative analysis is not enough. You can look at its outcomes, it's after the fact, and the more we can look at the qualitative analysis, the experience that people are having, are they feeling supported? Did they struggle? Was this a good experience or not? That is going to really help us understand how we support our staff who have to support our animals, and what we ask of them, and how they can give us feedback on, what's the value of those tasks. We also managed concerns around potential infection. We focused on our animal populations, focusing on the non-human primates. So we restricted movement of those outside of our facilities. And these are just some of the dashboard metrics that we used early on, making sure that we knew who was out because of COVID or OC health over guidance, and what that did to us managing our census. We also looked at how frequently and the numbers of our research community that were coming in, to know exactly who was in the facility and in what numbers, and where our bottlenecks. So we continue to monitor these metrics today, but I will admit, they do not tell us the whole story. And so the box at the bottom is left there because we know there's still a piece missing, and we have to figure out what that is, and we're doing that now. When we look at our staff and we talk about those qualitative assessments, this is where we start to see that while we did for 15 months seem to have a steady attrition, people were not leaving, we felt like they felt supported, but now we're starting to see that that the shift in moving around is starting to peak up. And so we have to be prepared for that today, to avoid getting back to that 30 in 6 months to a year, 30% attrition. So we're asking, what is this pandemic? What impact is this pandemic having on you? And this is just some of the data that's been published already about what to expect in those assessments. So I talked in my introduction about disruptors and how they could be used to through the performance standards process. And I just wanted to give you a couple examples that really worked out for us in this pandemic. So at Mass General, we do have a process for supporting the inclusion of performance standards in our operations. And we have laid it out in a way that also requires a validation that whatever we have proposed actually is realized, and then that gets reported back to the AWIC. One that we did in the past is actually looked at the need to have every 2-week sanitization of our wire lids and filter tops. And you'll be surprised, the one thing our managers say is saving the cleaning of the every 2-week cleaning of wire lids and filter tops is significant to the overall flow of equipment being sanitized and reassembled. And so we actually took reference materials We compared what that information gave us to our standards today, and we conducted our own validation study. And so we first looked at, could we go out 4 weeks? What was the impact on the animals? We looked at different things from animal well-being to microenvironment to what was actually being seen as far as changing or altering the health of the animals. And we went out 8 weeks, we went out 12 weeks, and we pretty much had proven to ourselves that this isn't without spot changing or without visually assessing the cage. So this was a new process for our lids that was considered spot changing in the end. And we reported that back to our staff, to our AWIC. We also, many years ago, for a completely different reason, had come up with what we called the definition of a dirty cage. It was much more to make sure our researcher felt like we were doing good animal care based on their visual assessment of their cages. And so together with our research community, we created this visual standard that hangs in every room about what a spot change cage would look like, or one that needed one. But in addition, we were still changing cages every 2 weeks, whether they needed it or not. And so when the pandemic came and we realized we needed to pull out as much work as we possibly could that was not necessary, spot changing was a key part of that. And not only did we look at where we would see the benefit, and you can see in the data at the right, before the pandemic, that shows you the amount of spot changing per facility that was going on. And then of course, as we would expect, afterwards, there was a significant, that was now our focus. But we also realized a reduction in the number of cages that ended up going through the cage washer. We are still evaluating a lot of the impact on the animal, and I won't go into any detail because we submitted an abstract to ALAS to actually present that data, but I can tell you it's very interesting. It was not what we expected. So I'll end talking about where we go from here. And what I will say is that, again, if we take care of the people that we're asking to take care of the animals, then we're providing better care to the animals. But what's important to them now is very different than what was important to them before. Morale is important, flexibility for work, the sensitivity around the work that they're doing, their well-being, hybrid schedules, telemedicine. These were all things that really were not part of our program in any great detail before, but through this effort is very much a part of our program now. And the real question is, how do we build on that? So we're looking at moving forward and redefining our operations for the future. And so this is that second definition of disruptor, where we're now talking about changing, transforming an industry. And I would encourage anybody who is joining with us today to think about how we can do this by reducing the number of people, for example, because we're not going to be able to sustain that knowing what we know about public perception. We need to actually give everyone the experience that they are taking care and focusing on the animals, and that they're not being asked to do things that do not support the animals directly. So changing a clean cage actually disturbs the animal more than actually waiting till it met the definition. We are looking at even what visualization of a cage means compared to actually measuring different objective parameters, which comes through the smart caging technology. So we're very much interested in advancing that capability. Looking at work based on what must be done on site and what can be done remotely, and how teams can support each other. And I'll take that even to the next level of talking about telemedicine. We did launch a new advanced health poster that gives a lot more technology, QR codes, et cetera, videotapes to the education piece, or the education tool for the frontline staff. We had much more success in connecting with our research community virtually than we ever had trying to do it face to face. Especially when it came to protocol development and consultation. They usually didn't engage us, now they are. And this new idea of mixed reality technology, I think is extremely intriguing and has a place not only in telemedicine, but has a place in education and training as well. I don't think anybody, when it comes to making sure you have a way to give the most people access to information, would think that not continuing virtual meetings would be an advantage. I just recently got my Harvard Business Review, and one of the articles in the Harvard Business Review specifically this past May, June, specifically talks about the hybrid workplace. And I think that we all have to think about what that does to the way we do our work and how we might rethink the work based on space and time. Do tasks need to be synchronized? Do meetings, where is synchronicity important and where is it not? When people are able to work where they work best, then they are feeling fulfilled. So you have to look at what you ask them to do, what their preference is. How do you manage projects and workflow in this new reality? And how are you going to make sure that everyone has the opportunity to be their best at work? Things that will have to be addressed, workplace disparities. And this is not just related to diversity, equity, and inclusion. I have some facilities that have terrible IT infrastructure. I have some facilities that have physical distancing challenges and feel very remote, and they need to be supported with making sure that the institution is providing everybody equal resources. Taking advantage of emerging technologies, I think, is one of the key things that is highlighted in the article, again, that I emphasize will be part of who we are. So I hope that I've been able to touch on the key points, and I thank you for the attention. This is the mixed virtual reality. Everybody's looking at the need from wherever they are. And that is how I could envision some of our animal care looking in the future. So thank you very much.